Hi, I'm Mary Wong, and I'm a practitioner of traditional Chinese medicine, author of Pathways to Pregnancy, and founder of Alive Holistic Health Clinic. Tonight, I want to welcome you to my first post for 2018. That's right, I have been doing, this is my 71st post since I started, and I decided to take a 3-week break, which I had not done before. So I want to welcome you into the new year, and with that, my my initial thing was to invite a story of hope for you. And what occurred was I was going to have Carolyn Dubé from Fertility Matters Canada, who's the executive director, tell us about her story, her fertility story, but which was successful. And unfortunately, her child, who is 4 years old now, since her infertility issue, she ended up having to deal with her child who got sick and is now throwing up and making a mess all over the place. So we're going to talk with her next week, and hopefully she'll inspire you with hope with regards to your fertility journey. So tonight, I'm going to instead talk about what is the number one question that gets asked when people call our clinic. And that is, when do you start acupuncture when you're trying to conceive through IVF? Well, in fact, I would say when you try to conceive, period. I say any time is as good as any. The sooner, the better. And this is why. So let's say you're going to go do an IVF retrieval. And whether it is this month, you're already starting stimulation drugs, or if you are contemplating doing it in the next couple of months, I think it's really wise to start as soon as you can. And I'll go through a couple of reasons why and where you are and what scenarios you're at, okay? So first, let's take a look at a person who are months away from an IVF. So in Canada, well, actually in Ontario, there is one funded cycle for IVF. And so for some of the people that are on this list of getting onto an IVF retrieval process, the procedure, it takes time. And in fact, I know that some people, they're on the wait list and it's 2019 before they're going to even get onto that list. So there's a time to wait for that. So what do you do in the meantime? Well, the very first thing you want to do is start with changing your lifestyle and dietary habits, right? But that's not the topic for today. So today we're talking about acupuncture. So when do you start that? You can start that any old time, because what you want to do is impact those little eggs before you even get to the IVF stimulation drugs. And the reason being is that although what IVF clinics do, technology, they're good at trying to increase numbers, because that's why you're taking all these hormones to stimulate the eggs that you have per cycle, because what you want to do is make each and every one of them grow. So fertility 101 is that naturally we ovulate one egg per cycle, per month at ovulation. But within that ovulation cycle or menstrual cycle, there are a certain number of eggs, and it's different every month. It's different per each individual. And I'm not even going to bring age into it, because sometimes I've seen a young person who doesn't have that many, what we call antral follicles. And then other times they have a lot and they're like 40. So, and there are different conditions that way contribute to the amount of follicles that are there from the start. And for those of you who do not know what follicles are, so eggs reside within and develop within the follicle. But the eggs are not visible to the human eye or even by ultrasound until, at ovulation. You can see it as this. Let's see. Can I see a dot here on this piece of paper? Like a period. Well, you can't see that. Anyway, like a dot. That's when it ovulates. But what you can see is the follicle that it grows in. And you want that as juicy as possible to make your eggs as juicy as possible. And when you do that, that will help hopefully, the scenario of the quality of the eggs. So Western science wants to work on the quantity, and in Asian Eastern medicine, acupuncture will want to work more on the quality. And the reason why we say there's no hard evidence that acupuncture helps the quality. However, study by Lee Hollander Rubin back in 2015, what she discovered was that when she went through her research and a retrospective study where they looked at women who did acupuncture 3 months prior to IVF cycle, what they found was a higher take-home baby rate, live births. So there wasn't an increase in the number of pregnancies by adding acupuncture, but it was a number of live births that occurred. So to me, and when I scratch my head, what does that mean? So same number of pregnancies, but yet the people that did acupuncture had lower number of miscarriages. So that's great. Well, why do we have miscarriages? Well, then, one practitioner, author, oh my gosh, I'm losing my mind. Shaheen, Dr. Shaheen, there we go. Laura Shaheen from out of Seattle. She wrote a book on this, and where she's talking about, miscarriages occur. Typically 85% is due to embryo issues. So when we have a live birth, a higher rate of live birth through acupuncture, then my loose connection is that it can help with the quality. And the reason being is that 1, it increases blood volume to the ovaries. 2, it increases blood volume to the uterus. So it helps the uterus be tacky, sticky, relaxed. It helps the ovaries become plump and juicier, and increasing blood flow increases oxygen, increases nutrients. So in that way, it can help. So again, when do we start acupuncture? As early as possible. But have no fear for those people that are coming in and calling us up last minute. There's a new study, and I actually haven't read it fully, but even saying that acupuncture during the IVF stimulation cycle also helps pregnancy rates. So there you have it. And then for those people that are always reading on Google about pre and post embryo transfer with acupuncture, yes, we can do that as well. And that works more on the level of the uterus, though. So it doesn't do anything for the embryos. And that's why we say try to get acupuncture way before. So we're wanting to impact the eggs, the ovaries, and then for the pre and post transfer, which I think is always a good idea to do anyway, after when you go back to pick up your embryo, whether it is a fresh transfer or a frozen transfer, you can do that before the actual transfer itself. And in the research, it tells you to do it 25 minutes before, 25 minutes after the actual procedure. Well, that's procedural. That is for research purposes to make it convenient. But I'll tell you, in reality, if anyone out there has ever done an IVF transfer, you need a full bladder ultrasound. 99% of the people that are getting transfers done now, in this day and age, have a full bladder. So if you're trying to relax with acupuncture while you're simultaneously having a full bladder, tell me, what do you think? Can you relax? I say no. I've been there. Doesn't work so well. So I say it's better to do it the day before. So 24 hours before is fine. Or if you have a practitioner that can work later into the evening, absolutely do that. And then that will help increase blood volume to the uterus to be stickier and more receptive that way. And then the other thing is, the next day, you just go about your business and you don't have to worry about, oh my gosh, I need to get to the clinic on time, and you just focus in on the one thing. And then post embryo transfer, you can do that on site, that's fine. But again, I haven't found a clinic where it's completely relaxing yet. I've gone to a clinic where They have even a private room, but I'll tell you, it is sterile and it's cool and it's not great. So it's not conducive for relaxation. And post embryo transfer acupuncture sessions, it's all about having your uterus and you be relaxed. So let's not just isolate your uterus. We want you to be relaxed. When you're relaxed, your uterus is relaxed. So going to a clinic where it's more inviting, relaxing, with relaxing music, and maybe like a little eye pillow, your feet are warm, your hands are toasty, under little covers, different environments, typically less sterile, it's sterile in terms of it's going to be clean, but less clinical looking, like you want a homey place, right? So I think it's typically best to, if your acupuncturist is close by. All right. So the other scenario is if your acupuncturist is really far away from your place of transfer, I say just go home. Unless your acupuncturist is really close to home. Does that make sense? You follow? Because after the embryos are in, what you want to do is invite the uterus to be fully relaxed and open, and that will increase receptivity. Because imagine the procedure, not so fun. They're sticking a catheter in, they're sticking this metal rod up you, lack of a better word, and then it's procedural. And you have the doctor, you have the technician, you have a nurse, you have your partner if you have a partner, or friend or family, someone in there. So there's a couple of people in there. Probably not the most relaxing atmosphere. And your legs are split open. So again, we want an inviting place to allow your uterus, you to be relaxed and receptive, because if it's a day 3 transfer, it's going to be implanting in a couple of days, so you're setting it up. But if you're also doing a day 5 or a day 6 transfer with like a blastocyst, then they're going to be implanting within 24 hours up to 3 days, right? So again, you want to set the stage up. So it's not necessarily crucial to have you be at the acupuncture treatment immediately after. If you can, great. If not, don't freak out, and you can do it the day after. Hope that makes sense. And so again, in terms of when to do acupuncture, I say 1, as soon as you can. And so the next question then would be, how frequent? Well, it really is dependent on your condition. So if you are in a place where there's a lot of challenges, you have endometriosis, fibroids, cysts, polycystic ovaries, advanced maternal age, all those things, and there's, or all at once, then you want to have more sessions than a person who is 25 and has just been starting on their journey and want to be proactive. And in those cases, once or twice a month would be good enough for a person who's totally starting out and is young. If you have a condition, or if you've been trying for over a year, then we want to make sure that we are decreasing any kind of inflammation, decreasing any kind of autoimmune response that can be there, relaxing you in general. And by the way, if you've been trying for a while and you haven't had success, and with the complex of having others stressing you out, like at work, or having a dog be ill or family members be ill, these are just more layers of stress. So we want to help the stress response, because unfortunately when we're around chronic stress, our body it's difficult to wear them down, like allow them to come down. So acupuncture is a way to help that. I call it cheating, because it's like that, and it helps settle and down-regulate the autonomic nervous system, which is awesome. And it feels good. Even for those that are scared, I have witnessed women and men that completely relax even on their first time. Now, the third question then that comes along with is who should you see? Obviously someone qualified, but I'm going to be biased because I am a registered traditional Chinese medicine practitioner. In other places on earth, they actually call it Doctor of Oriental Medicine or Doctor of Chinese Medicine. But in my jurisdiction, we're not allowed to be called physicians yet. Hopefully it'll happen soon. So the credentials would be that, because you want someone that is an expert in the field versus someone who's just been dabbling or taking weekend courses. So not the most ideal if it's through a physiotherapist or a chiropractor or even a MD, because these people are entitled to take short weekend courses and then they're often ready to do it on their own. And I say not so qualified. And not only that, they have minimal experience with inserting acupuncture needles, which makes it a painful experience. And I've certainly seen some people, which includes, I'm just thinking to mind right now, I had a patient who came in, she was adamant that acupuncture can be great for her, but she had never found a good fit. And she said one reason or another, and a lot of them actually hurt. But by the time she came to us, she had gone through 7 other practitioners. And when she finally saw us, she stuck because it didn't hurt. She was relaxed. All the things that you really need to see when it comes to acupuncture. So when you choose an acupuncturist, make sure it's a good fit. You can relax with the treatment so that you're not tensing up with the acupuncture, right? And that they're qualified, that they're capable of doing painless insertions, because it shouldn't be painful. And if you saw my post, I think it was yesterday, just a picture, one of my patients who came in was her second time. So the first time she relaxed so much, and she knew that it's probably better to wear something comfortable. So she brought in her pajamas for day 2 or her second time of doing acupuncture, because she says, it feels like home. It's that relaxing. So that's how it should feel. And there are naturopathic doctors that also do acupuncture. Some of them are trained more than others, but typically you have to know that they are GPs of the natural world and they get a portion of their education on Chinese medicine, but it's not all, versus a person who's a doctor of traditional Chinese medicine who gets thousands of hours around TCM. So you want to pick that person, don't you think? Like if you're going to go for heart surgery, don't you think you want to see a specialist rather than your GP? Well, first of all, your GP won't be able to do it. But when it comes to unfortunately, the complementary world, it's like cowboys and Indians sometimes out there, right? So you really have to be educated and get your resources. Sometimes you can get good resources through Google, but find out through your friends or Facebook groups that you belong to, so that you can get a better experience and optimize your treatments. So that's it. There you have it. Next week, I really want you to join us, because we're going to talk to Carolyn Dubé about her journey and what had her be so passionate that now she's actually the executive director of Fertility Matters, which is a Canadian support group that's online, and they hold events, and she'll speak more about this and educate you more about this and tell her story. And the reason why it's important is because 1 in 6 have issues. Sorry, my phone's ringing, so that's why I'm just hesitating. This is what happens when things are just, on the fly. Anyway, I really want to thank you for being here, and I hope you got a lot out of this. And this year, I'm going to promise you that I'm going to give you lots of great tidbits and information, everything and anything to do with fertility, and maybe even during pregnancy, because pregnancy after you have fertility challenges is a big deal. Like nothing is comfortable after you've had fertility challenges. So please email me or PM me and tell me what you would like to see, and I will certainly add that to the mix. I've been told to do more cooking stuff. I think that's great. Recipes are important because we're all wondering what to eat when you're supposed to be gluten-free, dairy-free, everything free, right? Sugar-free. So we'll add some of that, and then we'll also talk more about conditions. So one of the conditions I'll talk about is endometriosis, which I haven't covered yet. And I'll bring on different guests. So next week, hopefully, Caroline can join us. And then the week after, I have Dr. Prati Sharma, who is the founder or co-founder of it's called, what is it? Conceivable Diaries? Something like that. I'm sorry. Again, this is all not preempted. So it'll come to me after. But it's Prati Sharma. So I'm excited about that. And there's just so much more to come. And one exciting thing I want to share with you is that the Canadian Fertility and Andrology Society has reached out to me to do a webinar. And I'm such an advocate for anybody who is doing fertility treatment, that we want you to have a better experience. So one of my goals as doing this webinar is to train the clinics, the fertility clinics, the fertility doctors, the REs, to just serve you better. Because I can't tell you how every day I get women and couples upset coming back from the fertility doctor. And they could be the best doctor in the world, but sometimes they just say the wrong things. Okay, so I am going to be that person who's going to make a difference, and I'm going to do this webinar, and I really hope that it'll get great uptake with the fertility docs. And that's it for now. So please pick up my book, Pathways to Pregnancy. For those of you who do not know this, I wrote this during the middle of the night for a year and a half straight, because I was on a mission. I had this calling that, stories of hope is really necessary. When I was going through my fertility challenges, by the way, it's 15 stories of hope, one of which was my own, and they're really wide and varied because every story is different. Circumstances, age, everything is different about it, conditions, right? But one way or another, one pathway or another, they find peace. They have a child of their dreams. And I wanted to share that with you because, see, when I was going through my fertility journey, women would come in totally in their bleakest of days, right? Anxious, depressed. And yet I would see them overcome this in time. I had the privilege of watching them overcome and have children. And yet I realized, when each individual walks in, they're very alone. Even though you go into this clinic and you see like 100 women waiting in the waiting room, it still feels like a really difficult and private and lonely journey because no one talks about it. So that's why I wanted to speak out, and that's why I wrote this book. And I'm so grateful that over the break, I've had more than one person, a bunch of people reach out and email me and tell me that it's the only book out there that has provided them hope. There's lots of books out there that tell you what to do. And sometimes it can be overwhelming. Sometimes it can be like, oh my gosh, there's just one more thing to do, right? But offering hope, that gets you through the journey, makes the suffering a little less arduous, and makes the journey a little less alone, because fully I identify with, and every woman that has gone through this can fully identify with this. So, short of babbling on, because I can keep on going, I'm going to sign off here. And again, I want to thank you for joining me, and I want to welcome you into this new year with a new fresh start. And I invite you to go through this journey moment by moment, hour by hour, without expectation, and yet still simultaneously have hope. So that's it for now. So have a great evening, and please join in next Wednesday evening, 7 p.m. I was accommodating 7 p.m. Eastern Standard Time because our guest is out east and they're an hour ahead. So that's it. Next Wednesday, 7 p.m. I'll see you. And please check out my previous posts because there are 70 of them. Check them out. Check out my website, marywong.life. And certainly if you're local, you can reach out to us at aliveholistichealth.ca as well. Okay, take care. Have a good night. Bye for now.